Rachel.
Welcome. I'm Rachel Snow. I'm the Chief of Population and Development at the Technical Division of UNFPA, and it's my distinct pleasure to welcome all of you to this side event in the 76th UN General Assembly, which UNFPA is pleased to co-host with the governments of Canada and Burkina Faso. Before I begin, allow me to just offer one point of housekeeping, and that is that below the transmission, for anyone interested, you may find a link there, or you will find a link there for the French interpretation. Ministers, distinguished panelists, colleagues, and friends, we're meeting today to celebrate the transition of the IDRC Center of Excellence on CRVS Systems to a new home at UNFPA. The expertise on CRVS that has been generated by the IDRC in these past 5 years has allowed the center to become a recognized global public good that is advancing development, advancing legal identity for all persons, and fulfilling the Sustainable Development Goals. Now, it's the aim of the UNFPA to build on that very high standard that has been set by IDRC, to sustain it and to grow it, and to extend it to more countries with the help of many of the institutions and people who are with us today. We have an extraordinary panel of experts with us, and they will be not only celebrating the accomplishments of the IDRC Center to date, but also giving us some guidance on what are the true challenges ahead and what are different approaches and efforts that have been very successful at national level. Before we begin with our panelists, allow me to introduce the first of our two keynote speakers. The first I'm pleased to welcome is Jean Lebel, who is the president of the IDRC. Jean Lebel, please, you have the floor.
Thank you very much, Rachel. Good day, everyone, distinguished guests, friends, and all people that work around the world on CRVS system. It is an honor this morning, truly an honor, to be here to underscore the importance of civil registration and vital statistics system to the Sustainable Development Goals ambition to leave no one behind. It is equally an honor to be here to celebrate the important contribution made by the Center of Excellence on CRVS and the Center's exciting new chapter as it's transitioning to the UNFPA leadership. I will touch on 3 points: the importance of CRVS, tell you a little bit about the Center of Excellence, and then, move in my closing remark. So, the importance of CRVS. Many are converted here, and I'd like to address it in 2 ways. First, from a bird's eye view, and then from how CRVS impacts one life concretely. From a bird's eye view, we cannot achieve the SDGs without functioning CRVS system worldwide. CRVS systems are essential to monitoring progress against at least 67 SDG indicators. They are directly related to achieving 12 of the 17. Yet, many low and middle income countries do not have well-functioning CRVS systems. As data of UNICEF shows, worldwide, 1 in 4 children under the age of 5 does not officially exist. Despite progress, the world is not on track to reach SDG target 16.9 to provide legal identity for all, including free birth registrations. Additional investment and know-how will be required if we are to meet the target. Now, from the bird's eye view, let's go to the ground, and let me tell you about the story of one person and her family. Her name is Blessing. She's a woman in Western Kenya who realized that marriage registration was an important safeguard for herself and her daughters. She convinced her husband to join the small percentage of couples in Africa who have registered their marriage. 4 years after they registered their marriage, Blessing lost her husband in a traffic accident. Her husband's relatives tried to claim her land and the family's money. With her marriage certificate, Blessing and her daughters were able to keep their land and access the money in her husband's bank account and use it to pay the school fees for her daughters. This is just one snapshot of how registration protects rights and improves lives in a very real way. My second point is about the history of the Center of Excellence for CRVS. The center was established in December 2015 with seed funding from the Government of Canada through Global Affairs Canada and funding of IDRC. At its inception, the Center of Excellence was the only global organization focused on addressing all aspects of civil registration, including birth, marriage, death, and its causes, and divorce. Today, the Center of Excellence is recognized globally for its research innovation, best practice resources, technical assistance, and expertise. And I won't swamp you with all the numbers that I have on the fact sheet, but I'm sure it's available on the website. Canada's support has underscored the importance of well-functioning CRVS systems as foundational for many global health and development outcomes aligns with Canada's international assistance priority, most importantly, gender equality. For instance, everyone knows that when women and children are excluded from CRVS systems, they are at risk of being denied basic human rights. A well-functioning CRVS system facilitates access for women and girls to benefits such as financial service, the ability to claim inheritance, and protection against child marriage. Since the emergence of COVID-19, CRVS systems are more important than ever. They help policymakers understand the impact of health crisis and deliver tailored policy responses, including vaccines. In 20 countries, the center provided technical assistance that resulted in remarkable improvement in the CRCS system. Canada's support for the Center of Excellence is providing a stepping stone for development partners to continue this great work and ensure continued improvement of CRVS systems worldwide. And now to my closing and final point, the future of the Center of Excellence for CRVS system. I would really like to thank and congratulate the UNFPA for assuming leadership of the Center of Excellence. Julita, please carry my word to Diana for assuming, this responsibility. This transition from IDRC to the UNFPA underscores a growing partnership between our two organizations, as well as with Global Affairs Canada and Global Financing Facility. This transition is a natural fit given the existing collaboration between IDRC and UFPA on the Convergence Initiative, which connect vital events registration to gender equality. With leadership from UFPA, the Center of Excellence will extend its reach and its impact. Julita, I would like to thank the UNFPA for recognizing the important role of the Center of Excellence played in the world and for continuing this work. The need for strengthened gender-responsive CRVS system is growing by the day. Through the leadership of the UNFPA, I am confident the Center of Excellence will build on its achievements to date and help the world fight the challenges that remain. I would like to finish by emphasizing, it's definitively Monday morning, emphasizing this idea, emphasizing this. IDRC remains deeply committed to the CRVS agenda, and IDRC remains committed to actively working with partners at global, regional, and country levels to advance their work on civil registration and vital statistics. It's a journey that started 5 years ago for us. It's a journey that is not over with you at UNFPA and with us back there helping out in any way and form that we can. Congratulations. Have a very good meeting. I'll be with you to listen to our fantastic panel. But now I'm passing the floor back to Rachel. Thank you very much, everyone.
Thank you so much, Jean-Libel. Very much appreciated, and so important for you to set that vision and the aspirations that have been there since the beginning. Thank you so much. I would, before I turn to the next speaker, allow me to say that we do extend apologies from Dr. Dianketa, who has been called to an urgent alternate meeting. But in her stead, we're absolutely delighted to have Dr. Julita Onabanjo, who as of August is the new director of the technical division at UNFPA, where the new Center of Excellence will be newly housed. So I think it's particularly salient that we have you with us, Julita. So please, over to you for your keynote.
Thank you, Rachel. Thank you. IDRC President, Dr. Jean-Libel, Honorable Minister, Madame Sagon of Burkina Faso, Director General, Dr. Juan Oviedo of Colombia, Dr. Samira, Assistant Director General for WHO, distinguished panelists, colleagues, partners, and friends. It is an absolute pleasure to co-host this event on the sideline, the 76th United Nations General Assembly. Today indeed marks that official transfer of the IDRC Center of Excellence on Civil Registration and Vital Statistics Systems to its new institutional home at UNFPA, and the entire UNFPA, from its global headquarters here in New York to its country offices around the world, are extremely excited. So thank you. So allow me, really on behalf of all of us at UNFPA, to extend our immense thanks to Canada for its global leadership and development, and for championing civil registration and vital statistics as a critical means to advance the 2030 Sustainable Development Agenda. We really are honored to count Canada as a trusted and long-standing partner, one that promotes high-quality evidence, research, innovation, and data in support of gender equality and sexual and reproductive health and rights, but also in life-saving humanitarian actions. I would also like to acknowledge and thank IDRC and the President for his kind words and his commitment and confidence in us. I think our collective vision and the excellent technical partnership is one that we really are pleased to be continuing. The transition really reflects how it's growing and it's deepening, and in in advancing a global agenda on CRVS. And we really do look forward to the role we now have in hosting this amazing Center of Excellence. I think it's also wonderful to have with us senior leaders from Burkina Faso, Morocco, Colombia, the World Bank, Global Financing Facility for Women, Children, and Adolescents, of course, the World Health Organization, Paris 21, Help Age International, and many others that have joined us to mark this important moment in recommitting the universal vital event registration that ensures we leave no one behind. Quite simply, for us at UNFPA, it's because everybody counts. So distinguished colleagues, civil registration is fundamental to personhood and securing one's legal identity from birth till death. Yet millions of people are born, they're married and die without leaving a trace of their existence in legal records. In many developing countries, civil registration and vital statistics systems are weak, they're incomplete and fragmented, many due to, of course, the inadequate resources invested, including human resources, poor coordination and monitoring, limited use of ICT and digitalization, and constraints that particularly exclude women and girls. Under-registration is particularly high for those who live in locations that are remote to registration facilities, that lack access to information, whether written or digital, that lack the economic means to register a life event, whether it's in direct fees or out-of-pocket costs, such as travel costs. For those who are on the move or living in circumstances disrupted by armed conflict, of course, the current climate events and other crises. And more recently, the COVID-19 pandemic has laid bare the inadequacies of registration systems, with many deaths uncounted as death registration systems became overwhelmed, and many causes of death just simply unregistered. Fundamental to women and girls' full equality and bodily autonomy is equal protection under the law, the recognition of women's legal rights and human capabilities on the same basis as men. And civil registration and vital statistics is a critical enabler for women's empowerment, as it affirms women's legal standing and that of their children and their ability to claim basic rights. Without it, they just fall through the cracks. And really wanted to thank IDRC President for the human interest story around blessing. I think it summarizes really the importance of what we're talking about. Legal identity is indeed indispensable to leaving no one behind, as it proves that place, date of birth, and family ties, affirming a relationship to community and the state, guaranteeing entitlements and the obligations of citizenship. And I take, for example, the marriage registration. It provides women with protection under the family code and ensures legal rights to inheritance. Without marriage certification, women become vulnerable to disinheritance, loss of parental rights, and access to basic entitlements such as land and property. And in the case of divorce, where there's no certification of a divorce, there could be no legal basis for distribution of parental responsibility, or again, for common property at the end of the marriage. And for us, again, particularly birth certification provides that legal documentation of age and has the potential, we feel, to protect a girl from early forced or child marriage. Therefore, civil registration vital statistic systems not only play a role as an important population data source for routine planning for many sectors, whether it's housing, food, transport, public services, but also for insights on reproductive health outcomes, such as maternal and newborn deaths, and for changes in fertility, especially adolescent fertility. But also, CRVS secures basic rights. And as crystal clear, the critical role of civil registration and vital statistics play, I think we all agree we are far from that we had promised. We must acknowledge the underinvestment and subsequent undercoverage that we still need to address to end invisibility. Over the last 5 years, the Center of Excellence for Civil Registration and Vital Statistics System, launched and hosted at IDRC, has been laying the foundation for accelerated progress towards universal vital registration. The center has established itself as a global thought leader in CRVS systems, synthesizing country lessons learned, advancing gender transformative potential of CRVS, and hosting a rich reservoir of knowledge assets and technical tools, as we were informed this morning by the President. The population and health challenges that many countries and local communities face are complex and multi-layered, and we think it requires a whole-of-system approach. And so the Center's transition over to UNFPA is part of a deliberate approach to strengthen integrated population data systems. This transition aligns with the Center's vision, technical systems, and capacity development in CRVS systems, and with UNFPA's new bold strategic plan, 2022 to 2025, which calls for even greater efforts to integrate support of population and housing census, household surveys, health information systems, and geospatial data systems. We think we really have a winning formula up ahead. This new hosting arrangement also embeds UNFPA's global reach into the Center of Excellence through the UNFPA network of over 135 country offices. And I know a few of our representatives are here, but in over 150 countries across the world. Also across 6 regional offices that UNFPA has and its global headquarters. In short, this new hosting arrangement extends the Center of Excellence reach through UNFPA's technical colleagues on demography, population statisticians, geospatial data specialists, and human rights experts, but also positions the center's expertise and resources closer to key line ministries responsible for CRVS within a value population data offering that is aligned with the UN reform system and the resident coordinator system. And I'm so glad we have our resident coordinator from Laos with us today, but in close partnership with others who are indeed champion civil registration and vital statistics, including the Global Financing Facility and the World Bank Group. Colleagues, the future of sustainable development agenda is directly linked to fulfilling the aspirations of everyone, including women, girls, and adolescents, empowering the world's women in full partnership with men and boys in the world's 1.8 billion young people via universal civil registration, and unleashing their full potential will be instrumental in bringing to life the vision and promise of the ICPD Program of Action and of the 2030 Agenda for Sustainable Development. Dear friends, invisibility disempowers. It disempowers the individual to fully participate in social, economic, and political life. It disempowers the government, private sector, civil society partners in ensuring health, social, and economic opportunities are accessible to all. So on behalf of UNFPA, I warmly welcome your engagement with the Center of Excellence on Civil Registration and Vital Statistics Systems, and invite you to join us with UNFPA, IDRC, and other partners in transforming our aspirations for inclusive and integrated civil registration and vital statistics, and better population data in sustainable development progress. Quite simply, it's because everybody counts. I thank you and hand back over to Rachel.
Thank you so much, Julita. And indeed, underscoring the myriad ways that CRVS is so crucial to leaving no one behind, to the ICPD and to the 2030 agenda. Thank you so much. And the commitment is coming through very clearly. And anyway, along with all the partners here, we will champion success under your leadership. So delighted to have your comments and have you with us. I'm now going to turn to the panel, and our first of our panelists is also a co-host, and I'm delighted to welcome the Honorable Minister, Ms. Madiera Sagnon, who is the Minister of Decentralization, with us now from the government of Burkina Faso. So, Ms. Sagnon, please, the floor is yours.
Okay. Bonjour. Okay. Good afternoon, everyone. My name is Madiera Sagnon, and I'm Minister for Decentralization in Burkina Faso. I would like to give you the perspective of Burkina Faso on CRVS. Dr. Johannes and Secretariat of Paris 21, also Sir Jean Lebel from the IDRC, UNFPA, Mr. Georgette Abba from Global Health and Nutrition, Global Affairs Canada, and dear colleagues, panelists. It is a real pleasure for me to take the floor today for this side event, which is an opportunity for me to share the experiences of Burkina Faso for the modernization of CRVS. First of all, I would like to express my sincere thanks for UNFPA and all the partners for their contribution for the efforts that have been carried out to modernize our national CRVS. Now we want to have a unique identity for each citizen, and this was rendered possible with a digital platform that allows to register all vital statistics. Thanks to the excellent collaboration with UNFPA and also with its partners, the World Bank and Government of Canada, Burkina Faso is firmly committed towards modernizing its own CRVS and in conformity with the international engagement commitments. We have had good outcomes, and this collaboration contributed to convince the Government of Canada to transfer the Center of Excellence to UNFPA. I would like to seize this opportunity to reassure the Canadian government that this choice was the right choice to accelerate the modernization initiatives of CRVS across the world under the leadership of UNFPA. Ladies and gentlemen, the technologies for CRVS chosen by Burkina Faso present a certain number or allow us to overcome the obstacles. We have a central database that allows the local communities to provide data for the whole country and also through our embassies. The citizens will no longer have to go to their local communes to get their certificates, and at the level of municipalities, we will also be able to plan all the needs, and in particular for health and education. The production of vital statistics from this central database will allow us to address the gaps in terms of the women's and girls' rights, marriages, risks of maternal death, etc. Ladies and gentlemen, in Burkina Faso, the collaboration with UNFPA, we have been able to have 3 observatories to investigate on the registration of vital statistics. We have been able to digitalize data, and the conclusions of this work were taken into consideration in a national strategy, and we are promoting these digital data. We've had the 5th census, and we will have the data for 2021. This census will allow us to have a better knowledge of birth, marriage dates, level of education, and the several inequalities between men and women. We also have statistics for the age of parties for the first marriage. And this will also be useful to address various stigmatization. And we want to reach the 3 results by 2030. We are improving CRVS, and Burkina Faso was also helped by the Center of Excellence in terms of training and capacity building, and also the availability of document resources in order to strengthen the management of CRVS. Burkina Faso has committed itself in that direction, and we will be glad to share our experience with the Center of Excellence for CRVS and with other countries as well. In spite of the difficult security context, where certain regions of the country are under emergency status, we are going forward with the modernization of CRVS. And before I close, I would like to, on behalf of the President of Burkina Faso, I would like once more to say that I thank you all, to show my gratitude to the whole UN system, and in particular UNFPA, for its contribution to the modernization of our CRVS system. Thank you for your attention.
Merci beaucoup, Madame Sagnon. This was very much appreciated.
Thank you very much, Ms. Sagnon. We appreciate it.
I think the attention to decentralization and what's possible during this decentralization process of government, and how you've been able to capitalize on that to bring CRVS closer to people. This is anyway a marvelous example. Thank you so much for your support also. I would like now, if I may, please, to turn to Dr. Juan Daniel Oviedo, who is the National Administrative Department of Statistics Director in the Republic of Colombia. And I believe also we are here again of this effort to move CRVS not only within the health sector, but also to community level. So please, Dr. Oviedo, the floor is yours. Welcome.
Thank you very much, Rachel, and I'm very grateful with the UNFPA for the invitation. This is an honor for us in Colombia to be part of this side event. And today we would like to share with you in a very efficient way how, thanks to the collaboration between the UNFPA and the National Statistics Office, we have started to perform some metrics that are going to be very useful to allow the subnational effectiveness and granularity of vital statistics in our country. And this is a project that, first of all, we would like to say that we are tremendously and we are very thankful with this collaboration framework that we have developed with the UNFPA from the National Statistics Office. Several issues that were very, very important in the closing and the wrapping up of the population and housing census of 2018, and the implementation of metrics and statistics that could provide some light about the demographic evolution of Colombian population have been possible thanks to the collaboration and the continuous work with the UNFPA, both at the Latin American level and also at the Colombian headquarters. We are going to share with you today the experience that we have had the opportunity to develop as regards as the Converge project and the development of a continuous evaluation framework of quality of vital statistics in our country. The main objective of this project, as you may imagine, is how are we going to allow a quality, opportunity, and coverage of vital statistics to disseminate at the national level, taking into account the heterogeneous socioeconomic conditions of the populations around the country in Colombia. And we try to develop this, let's say, benchmarking scenario under a platform under which, first of all, we defined the set of indicators that we wanted to produce continuously in order to understand from the regional and the subnational heterogeneity how the effectiveness of vital statistics is going to improve in our country, taking into account that we also have to consider that the heterogeneity of our country is not only a geographic one, but also an ethnical one. You have to keep in mind that in the rural area, we have a high participation of indigenous population and people from African descent that they have to be visible in the vital statistics framework. That's why once we set the indicators from the opportunity, completeness, consistency, and coherence perspective, we understood that this could allow us to have a quality framework under which we could perform some kind of benchmarking from the territorial level that was going to be useful to understand how the effectiveness of reporting of vital statistics was happening in our country. And that's why, for example, in the case of the Department of Chocó, that has a very, very important participation of people from African descent, and at the same time, for example, the most recent measurement of poverty, multidimensional poverty, signals that 49% of the population of the Department of Chocó is under multidimensional poverty. We can see how even the difficulties of from the socioeconomic perspective in the Department of Chocó, we are seeing an improvement on the timeliness of the reporting of vital statistics. For example, take into account that in 2021, we are seeing that 54% of vital facts are reported at the same time that they were happening in the Department of Chocó, something that was happening just for 20% in the year 2018. So we are going to have an evolution from the time perspective, but at the same time, we are going to have a benchmarking attribute that is going to be very useful, not only at the department level, but also at the municipality level. For example, you can see that we can compare how the effectiveness and the timeliness of the main vital facts that we are reporting in the system of vital statistics is quite heterogeneous even inside municipalities of the Department of Chocó, and this is going to be useful in order to provide some training, some capacity development, and at the same time, we would like to have a phase 2 of the project under which we are going to develop subnational capabilities in order to close the gaps and to allow that vital statistics are efficient and at the same time have this attribute of timeliness, which is highly important. At the same time, we need to develop subnational capabilities, and this is going to be tremendously important as regards as the ethnical perspective of these local capabilities that we would like to develop, because we are going to increase our participation in the Partera Vital strategy. You have to keep in mind that we need to diminish the omission or the statistical omission of births that occur in people from African descent and indigenous population. And this is very important, for example, in the case of the Department of Chocó, when you see that traditional birth attendants are the main way under which births are attended in the Department of Chocó. So we have to allow a simple registration of those births in order to allow them to be visible in the system of vital statistics in our country. And this is something that we wanted to share with you today, because the timeliness of vital statistics in Colombia has been tremendously important. For example, to provide last Friday an early alert about the increase of early childbearing in Colombia, probably due to the lockdowns and the consequences that even UNFPA had insisted some months before that could happen as a bad consequence of the lockdown. So thank you very much, and we are very grateful with UNFPA for the development of this project.
Thank you so much, Dr. Oviedo. Really a pleasure indeed. Just to make sure, can you hear me? Yes, okay, sorry. Indeed, and you know, this concept of continuous evaluation and the efforts you're making for disaggregation, certainly I must say to know where and who is indeed being left behind, this kind of precision is exactly the kind of innovation I think that in population data systems we're very much after in this next rush to the decade of action to 2030. I would like now to turn to Dr. Samira Azma. It's my pleasure here to introduce the Assistant Director General of Data Analytics and Delivery at the World Health Organization, who has made CRVS a cornerstone of the work that she's leading, both within the score, assessments, but also, of course, in the widespread implementation reach across the world. So, Dr. Azma, please, the floor is yours.
Thank you, Rachel. I think the organizer may need to undo the video. I'm unable to. Yes, now it works. Thank you, Rachel. And thanks to our distinguished panelists. I would like to thank and appreciate the hosts for getting us together to appraise a very vitally important topic today. Throughout the past 1.5 years, the pandemic has been a tragic reminder of our inability to accurately document the human lives we have lost due to COVID-19. And let me tell you why. We use the measure of excess deaths estimates to report on and understand the true scale of the pandemic. However, it is important to recognize that even the measure of excess deaths relies on good measures of CRVS. Rachel, you mentioned about the score for health data assessments. This recent assessment of the country's health information systems capacity, which was done for the first time, found that 4 in 10 deaths worldwide remain unregistered. And a shocking 9 out of 10 deaths are unregistered in African region alone. This is one of the reasons that we are unable to track the true impact of the COVID pandemic. While counting deaths is crucial, it doesn't tell us the whole story, nor help the governments and the global community to allocate right resources at the right place and the right moment in time. We also need to understand how and why people die. Just like a surgeon needs qualifications to perform surgery, specialized skills are needed to assign causes of death. Here are some more statistics, quite grim. 77 countries still don't produce any cause of death data. And 78 countries produce low quality cause of death data. Now let me turn the page to some positive outlook. The crisis has also created a new sense of urgency that is reflected in today's discussion. And what we need is truly multi-sectoral partnerships, bold leadership that will champion for investing and technical assistance. Dr. Tedros's transformation agenda is to deliver impact in countries, and our member states have recommended WHO and its partners 3 things. 1 is to strengthen their country data and health information capacity so we can close the data gaps that I mentioned. 2nd is to make data available. And finally, the 3rd is, what good is data if it is not used to drive impact, improve performance of policies at large? WHO is doing two things. One is have made CRVS a priority and a flagship. In consultation with partners and countries, we have developed a 5-year implementation plan, which focuses on 4 areas. One is to strengthen coordination between health sectors and national stakeholders, as well as international partners, and that this is happening already. Strengthen the cause of death reporting, vital event notification and integration of information that you already mentioned. Building capacity to analyze and use mortality and cause of death data for policy design, and improve reporting, production, and dissemination of vital statistics. The second area is the global SDG action plan, where 14 multilateral organizations that are all here today, many of them, are joined together. And I'm really thrilled to say that UNFPA and WHO are co-chairing the Data and Digital Accelerator within the SDG Global Action Plan. And we truly look forward to working with everyone, because in 2025, the score for health data assessment will be repeated again. We know what the baselines are, and we know what our ambition is. Our ambition is for every country to have robust data systems where every country can have timely, reliable, disaggregated, accessible, and actionable data. And it is possible because we have the solutions, as has been expressed from the Centers for Excellence in Canada, in Africa, in many countries, best practices that can be scaled. But what we need is speed. We have partnerships, we have tools, we have the willingness. Now I think our actions will truly define whether indeed we are serious about this topic, which is truly a sign of good governance globally as well as nationally. Thank you, Rachel, and back to you.
Thank you, Dr. Asma. And I have to apologize. I'm not sure you realized, but we weren't able to see you as you were speaking. And I mentioned that it would be great if we can put you online visibly now. There you are. Okay, yes, we saw you momentarily. There you are. Okay, great. So please, yeah, thank you so much. And fabulous to hear about the 4 areas of work. As you know, UNFPA is very keen to be working with you on the SDG action plan. And I think we're all looking forward to seeing those assessments of score marking progress and seeing tremendous advancement in the next round. Thank you so much.
Thank you very much.
I am now going to turn again to Mr. Mohammed Fasifiri, who is the director of the Center for Demographic Studies and Research and the High Commissioner for Planning in Morocco. And we understand there's been really an extraordinary amount of innovation in Morocco. And so we're very, very much delighted to have you with us. Dr. Firi, please, the floor is yours.
Merci. Bonjour, je m'appelle Mohammed Fasifiri. Je suis effectivement directeur du Centre d'études et de recherche démographique au sein du Haut Commissariat au Plan. Tout d'abord, je suis très heureux d'être parmi vous aujourd'hui pour parler du système d'état civil au Maroc et aussi de notre
and our collaboration with UNFPA. As you know, CRVS Systems, as of course administrative use, statistics are able to meet various needs, whether they be public health or demographic. They can help with planning development at a very small level, even the commune level. These CRVS system, a good system, is a source of data which gives data on the national scale at a relatively low cost if you compare it to census, for example. These statistics allow us to calculate various demographic indicators which allow us to monitor the evolution and our progress for the SDGs. Ladies and gentlemen, in Morocco, using these CRVS data is done with the High Commissioner for Planning and the Ministry of Interior, collecting both births and deaths is done over 2,000 offices, which are all over the Moroccan territory. Of course, we wish to improve our system, and this is why, since 2018, we have launched an ambitious national program for modernizing our CRVS systems to be able to overcome various difficulties in terms of collecting this data and processing it. This means digitizing various data collection points. We have two regions. We have Rabat and Casablanca. This is where we first started, but we will now bring it to our entire territory. And a cooperation agreement between the Ministry of Interior and the High Commissioner for Planning will lead to the monthly automatic transfer of these digital CRVS data. Ladies and gentlemen, the High Commissioner for Planning, with other partners, has assessed the données, and we also did qualitative analysis in the rural areas to look into the qualitative issues relating the collecting of death data. The result of this activity led to 3 reports. There was a report, one on births, one on deaths, and one on the various determining factors and impacts on CRVS systems in the peri-urban and rural area. The recommendations are the basis of our action for improving our data. Ladies and gentlemen, Morocco has seen a great progress in its CRVS system. We had a 50% under collecting of or under reporting of deaths, 18 to 7 from 18% to 7% for births, and I have a few recommendations that I would bring up, and I will refer to these reports. Improving various aspects of collecting data and sending it needs a strategic plan, which is not only limited on births and deaths, but also will have the cause of deaths and integrate as well data on weddings and marriages. We also have an outreach campaign and a communication campaign on the use of using these CRVS systems and to declare both deaths and births. The analysis that I mentioned will target first men, but also we will try to reduce the administrative burden for declaring a single window for registering these life events, and in rural areas using a doctor's note for the declaration of deaths. And I would like to thank the UNFPA for the financial support, and I would like to thank you all for your attention. I hope I wasn't too fast for the interpreters.
Thank you so much, Mr. Firi. This is really excellent. And I think the common themes of digitization and getting to granular and going subnational and making sure these systems are timely is coming through very, very clearly. And the recommendations you offer are important for all of us. So thank you very, very much for that. Indeed.
Merci.
Okay, merci. It's my pleasure now to turn to Dr. Johannes Juting. From Paris 21, the director of Paris 21 Secretariat at the OECD. And we know that Paris 21 has been really a groundbreaker in assessing data systems in the Global South. And that even more recently has really been a leader in assessing and reminding all of us of the scale of investment required to build data systems and fulfill our obligations to the Sustainable Development Goal vision. So it's my pleasure to invite Dr. Juting, please, now to speak and to put CRVS in the context of these broader needs and initiatives. Please, the floor is yours, Johannes.
Thank you very much, Rachel. Good morning, good afternoon, a warm welcome from Paris. No, it's really exciting to be part of this important event. I'm very grateful for the invitation. It happened so that my last mission went to Canada to one of the events that the Center of Excellence organized with Open Data Watch and I believe IDRC and a few others in February 2021, exactly on the linkage between CRVS and gender and foundational data systems. So I was very grateful that Dr. Asma and many of the country speakers and my colleague Juan Daniel from Colombia all made these very nice references to how actually we have to think about foundational systems and how important foundational systems are for strengthening gender equality and CRVS systems in general. So Paris 21 is a partnership, as you said, Rachel, that is supporting national statistical offices in poor and low-income countries. And we have been trying hard to help, and I think there's a lot of resonance these days in the statistical community to open up, to bring better civil registration and vital statistics together. And I think in particular in the field of gender, this is so natural that this is an important point. And there's a lot of open doors now also from the statistical community to seek opportunities for strengthening this link. I also very much concur what Dr. Asma from the WHO just said. I think we have to move away from purely a production lens of producing the data to more thinking about impact and use. How can we actually enable the use of such kind of a data? How can we facilitate through visualization, through capacity development that actually the policy makers are using that data that we produce? Let me just add, and I know time is short and many other important speakers will speak. I wanted to add two important points to the agenda. One has been said, just to stress this, is something slightly obvious, but so difficult to realize in resource poor environments, is the whole digitalization. It's the whole possibilities that has been mentioned, IDization, the use of blockchain. There could be a lot of technology leapfrogging. Of course, we have to avoid to be naive. What is really possible, in particular in low-income countries? But eventually, there is scope for some interesting projects to see what can be done, pilots in this field. So digitalization and this use of AI could be quite interesting. Now, I want to highlight the point, also make a reference to what you said, Rachel, earlier on, is financing. We have seen in many low-income countries, of course, funding for data and statistics is very low. Paris 21 is measuring and monitoring the support given to data and statistics, and it's every year under 1% of official development aid. It hovers around 600, 700 million US dollars per year, roughly. So we really need to increase the funding from donors. We also need to increase the funding from national governments, from domestic resource mobilization, and we need to spend the money better. And here's at least some good news, is that at the UN World Data Forum, which will take place in Bern, starting from Sunday, next Sunday, just in 6 days, there's a UN World Data Forum in Bern, in Switzerland, virtual and in presence, so a hybrid event. There will be a launch of a platform called a clearinghouse for more and better funding for data and statistics. And this platform is a sort of amalgam from different donors. It's a Bern network that exactly focuses on raising more and better funding for data and statistics. And we would be so happy to see with UNFPA and the colleagues of the Center for Excellency to see if we can put in channel for CRVS funding. So the whole issue about transparency, who provides money, who uses the money from donor to recipients, how can we improve the efficiency of spending, how can we do a better matchmaking to raise the resources, but also to spend them effectively. We would be so happy to continue this conversation, which just started, and looking very much forward to continue this conversation. Let me just close by saying I'm wishing you all the best to the colleagues of who moved to UNFPA. And happy to stay in touch. And thanks so much for inviting us to this important event. Thank you very much.
Thank you so much, Johannes. And I think indeed, We were very, very much hoping to hear exactly what you've shared with us. And this idea of a clearinghouse for financing and a channel for CRVS is a great idea. We're with you, and let us work on that together as best possible. We know the need is enormous across the board on data and statistics. So all that we can do together would be excellent. Thank you so much. And it's my pleasure now, and in fact, I hate to say, speaking of financing, to introduce Ms. Petra Vergier, who is the lead on knowledge and learning and results-based financing with the GFF. And it's really the global financing facility for women, children, and adolescents at the World Bank. And we know that in terms of results and financing, this is a new architecture, and you are really among the major architects of these kind of new innovative strategies for financing, including, of course, for civil registration and vital statistics. So please, Petra, to you for our onward look at solutions. Please, the floor is yours.
Thank you, Rachel. Thank you for the opportunity to speak on behalf of the GFF on the occasion of the transition of the Center of Excellence for CRVS Systems to UNFPA, which we're really excited about, and our congratulations. We appreciate the partnership between the GFF and the Center of Excellence over the past 5 years, in close collaboration with the IDRC and Global Affairs Canada, as well as with other CRVS partners at the global, regional, and country levels. Sustainable, equitable, and gender-responsive CRVS systems are critical in building and maintaining resilient health systems to ensure the lives of all women, children, and adolescents are counted and accounted for. Without legal documentation, millions of women and children could become excluded from social services and health coverage, leaving them more vulnerable to human rights violations. And as we've heard, with COVID-19, the need for better CRVS systems has never been stronger to register and certify vital events, but also as countries need to develop informed strategies to better target health service delivery as part of their response and recovery efforts. The GFF is a country-led global partnership hosted in the World Bank, committed to ensuring all women, children, and adolescents can survive and thrive. It currently supports 36 low and lower middle-income countries with catalytic financing and technical assistance to develop and implement prioritized national health plans to scale up access to affordable quality care for women, children, and adolescents. To assist countries in strengthening their CRVS systems, the GFF adopts a comprehensive health systems approach, prioritizing CRVS systems in country investment cases and making much needed funding available to support the implementation of CRVS strategies. To date, 22 countries have prioritized CRVS in their plans, and 14 countries have received around 100 million in GFF grants and World Bank financing specifically to strengthen their CRVS systems. The GFF's approach of supporting CRVS through financing from the GFF Trust Fund, directly linked to the World Bank financing, and mainstreaming this through health, has helped to provide substantial resources required to build sustainable CRVS systems. We are grateful to the Government of Canada, whose contribution to the GFF made these grants possible. Over the past few years, several GFF partner countries have made strides in improving their CRVS systems. For example, following the amendment of a national law allowing health officials to register births and deaths and issue certificates, the government of Rwanda, with a $3 million grant from the GFF and a $6.5 million from the government budget, upgraded their electronic registration system and expanded civil registration services to all health facilities. Unique national identification numbers are issued at birth registration, which allows interoperability with other information systems, thus facilitating social protection services to reach eligible newborns and their caregivers immediately after birth registration. Birth registration completeness reached almost 86% in 2020, while the Rwanda DHS of 2014-2015 estimated that just half of children under 22 years were registered. In Kenya, another example, a 1.2 million performance-based allocation from the GFF and the World Bank was provided to incentivize birth registration. The government focused on conducting regular monitoring visits to civil registration officials and sensitizing health teams in the counties to strengthen birth registration through maternal and child health services. Birth registration increased from 64% in 2016 to almost 83% in 2020. To help countries recover from the pandemic and build back better, the GFF is taking a holistic approach to mainstreaming support to CRVS systems, including prioritizing the reform of policies in the health sector to ensure live events are captured timely and at the place of occurrence, as well as advancing equitable and gender responsiveness and monitoring in all CRVS systems, building electronic systems for sustainable and efficient delivery of CRVS systems, and using CRVS data for decision-making, while at the same time advocating for more domestic resources for CRVS and strengthened partner alignments. To keep the momentum going, additional investments are required. This means increased domestic resources for CRVS, more partners joining the effort, and additional support to the GFF as part of our resource mobilization effort this year. All of this to continue supporting countries to develop sustainable, resilient, and gender-responsive CRVS systems. We look forward to continued collaboration with the GFF partner countries, the partnership between the Center of Excellence for CRVS Systems and UNFPA, the Government of Canada, IDRC, and other CRVS partners at global, regional, and country levels. Thank you, Rachel.
Thank you so much, Petra. And indeed, those two examples are very compelling and very convincing. Please, indeed. And we know that the GFF has been a critical leader in guiding and advising the Center of Excellence while at IDRC, and we're very much looking forward to the benefit of that continuing advice and guidance. So thank you so much for being with us today.
Thank you, and we feel exactly the same. We look forward to that continued collaboration. Thank you.
Thank you. I'm now going to turn to Mr. Justin Derbyshire, who is the Executive Director of Help Age International. And as you know, probably that Help Age is one of probably the largest global advocate for the interests of older persons. And this is an example of where I think civil registration and vital statistics extends into the interests of many, many that may not initially be identified with civil registration and vital statistics. Justin Derbyshire, your agency is probably, as I say, a lead advocate, and CRVS is indeed something which we see contributes to accumulated discrimination, particularly for women, where it is not sufficient or universal. But please, thank you so much for joining us today, and the floor is yours.
Well, thank you, Rachel, and thank you very much to all of the panelists. I'm delighted to be speaking today on an extremely important topic. It's critical that, as we've heard today, that the UN system and governments across the world support a life course approach to strengthening CRVS and assuring legal identity for all persons at all ages. And this is an ongoing issue. This is holding back, as we've heard today from different examples, not only kind of progress at a global level, but at a national and a local community level. And like so many failings in our system, COVID-19 has really shone a light on it. The pandemic has exposed many concerns about the completeness of death registration worldwide, especially at older ages. Far too many countries have not been reporting, and those that did were not disaggregating adults at older ages or by sex. We've heard a number of statistics today, and I want to show you some more though to show you the size of the problem that is preventing us at this current time to effectively deal with the COVID-19 pandemic. Of the 135 countries who reported to WHO, over 90% there were issues with the completeness of the data. Only 35% of the global COVID-19 cases have been captured in this reporting. And 5 countries accounted for 76% of the data. Now just consider this, how much we're missing in our global response to the biggest challenge that we faced in the last 50 years. As we've heard, the CRVS data informs the policies at national level, and then what you prioritize for health. Without the correct data, we don't have the full picture, and we cannot effectively support current or future generations. And as Rachel was referring to, in most cases, this leaves more and more people behind, and those most affected, women, people with disabilities, and older people. In 2018 at HelpAge, we did a report with a number of our partners and network members from around the world, the Global Age What's Insights that you can find on our website. And it outlined that only 9% of the deaths are registered in lower and middle income countries, and only 1% of the deaths were in lower income countries. More than half of the countries with no death registration were in Africa. In addition to the low coverage was the low quality of CRVS records, and it remains a challenge. A review that we saw from WHO recently showed that 119 countries that registered death, data from nearly 1/3 of those was estimated at too low quality. So the gaps in the CRVS systems are having a significant impact on the lives of older people. Those who were born without birth registrations, with less advanced, with lack of legal identity, and incorrect information such as the wrong date of birth can restrict an older person's access to services, their civic participation, and also critically their ability to claim their rights. In 2016 in Zanzibar in Tanzania, we did a review of the universal social pension that was being rolled out, and 30% of the older people interviewed did not have a birth certificate. 25% had an incorrect birth date on their ID card. And these were the main reasons that this cohort of older people could then not receive a universal pension at that time. You know, to kind of look at the impact, I visited the following year and I met Elizabeth, who was 72, who had been able to access the pension, and she had then been able to use the money to buy vital medicines she'd been needed to, and that had cleared up her eye infection, and then it had enabled her to carry on the activities that provided other sources of income for her. I met Anthony, who was 71, who'd used the pension to buy goats to give him another source of income as he aged. These were the fortunate individuals that had the right documentation. Others in their community did not, and were not able then to receive the valuable pension funds they were entitled to. There is a clear need to improve the data gaps, and especially the coverage and quality of CRVS. We've heard a number of examples today. That incredible investment is needed across lower and middle income countries. I thank UNFPA and the Government of Canada and others involved today, but more investment is needed. As we've just heard from the last two participants, it is critical that this area has the funding and financing it needs to ensure no one is left behind and everyone is counted. The UN system and the government has to support it, and the work of the Titchfield Group, City Group on Aging and Age Disaggregated Data. Prioritize them, prioritize the funding and the financing of these data systems. Without it, countries are blind to the true challenges they face. Thank you very much for your time.
Thank you so much, Justin. And indeed, you motivate us. I know we're also starting the decade of healthy aging, and the advocacy, collective advocacy, needs are enormous. We're very, very grateful for you to bring to the life here this sort of life course perspective and the reminder of the implications not only for missing birth registration at young ages, but how this accumulates for older persons. Thank you so much, and we really look forward to partnering further with you on many fronts, but in this area as well. Thank you, Justin. And now to the last of our panelists. I'm really delighted to turn now to Ms. Sarah Sekenis, who is the resident coordinator in the Lao People's Democratic Republic. And Sarah, we're very pleased because we understand that this is a case where one UN has truly been actualized, and particularly in the support of work on civil registration and vital statistics, working very closely with the government. Sarah, please, to you, the floor is open.
Thank you very much. And yes, indeed. Excellencies, good morning, good evening, colleagues, fellow panelists, all protocols respectfully observed. And as you can imagine, concluding this list of panelists, I will probably echo a few of the points, but you'll have to see it as reinforcing our collective message. As highlighted in the Lao PDR's National Socioeconomic Development Plan, civil registration offers much potential in realizing our shared commitments to leave no one behind, and vital statistics can provide key insights in population dynamics and development progress. And of course, as been stated, not only is this important to provide individuals with essential legal documents required to secure identity, nationality, and civil rights. Such insights are also important to ensure that public social service policies respond to the population needs. While the SDG indicator 16.9 is amongst the localized SDG indicators in Laos, much remains to be done. As part of the midterm review of the CRVS Decade in Asia and the Pacific, the government reported that birth registration is 43% complete, that of deaths 37% complete. So of course, what we have heard and what we may take for granted in modern society, to travel abroad, to open a bank account and lawfully and securely inherit, or to register partnerships, is not necessarily possible for all. And for children, the absence of birth certificate means the lack of legal protection from exploitation and access to justice when in contact with the law. Exclusion and invisibility, as also been mentioned, is not randomly distributed. The government recognizes the need to effectively address these challenges to tackle the persistent geographical disparities based on ethnicity, language, gender, age, educational attainment, disability, and social economic status. These crucial investments in integrated population data systems, CRVS, and population housing census using digital tools are therefore smart investments in realizing the promise to leave no one behind, wherever they are. The UN country team has taken a whole of system approach to support the government's CRVS system strengthening efforts. Apart from the World Bank support to the Ministry of Home Affairs through a $25 million IDA loan in improving coverage of the civil registration of vital events by digitizing the country's CRVS system, the WHO is supporting the Ministry of Health in notification of births, deaths, and training of physicians to medically certify cause of death, which was also mentioned as a vital issue. UNICEF is building public awareness of birth registration via parenting education programs and supporting mobile teams of Home Affairs to register children in remote districts. UNDP supports the establishment of a one-door service center across ministries and facilitates UNDESA's lesson learned across countries to help the Lao government finalize this approach. And UNFPA, finally, is focusing on the strengthening of marriage registration and improving the quality of vital statistics production, but also the dissemination and use, as was also pointed, and has also been placed to lead the coordination of UN support on CRVS to the government. The country has set an interim target of completing 70% of birth registration and 46% of death registration by 2024. And with UNFPA support, it is also on track for its next population and housing census in 2025. The family registration law and the national strategy guide our CRVS work. And the 2030 agenda and renewed commitments at the 25th anniversary of the ICPD program of action provide a real opportunity for accelerated action to transform the administrative data systems to be fully inclusive across the entire life cycle, as just was mentioned as well. The UN country team really welcomes the hosting of the Center of Excellence on CRVS Systems by UNFPA, and would also like to take this opportunity to thank the Government of Canada for its sustained commitment to inclusive societies and gender equality. We look forward to harnessing the Center's practical guidance and technical tools, but also in contributing insights from Laos CRVS system strengthening efforts to the global repository of lessons learned. Following the recommendations of a joint vital statistics assessment, it is our ambition to provide comprehensive, collective support to the government, and we will further consolidate efforts to offset the negative impacts of COVID-19. As Laos transitions from a predominantly rural society to being over 50% urban in the coming years, The UN, with partners, will support government efforts to ensure that Lao people from all 50 ethnicities, especially women and vulnerable groups facing challenges of language, terrain, social norms, and behaviors, have security of legal identity and social inclusion so that Lao PDR can realize its potential for a demographic dividend over the course of the next decade or so. With this, I thank you for allowing a Lao perspective on this panel and count on the continuing and hopefully growing support from the Converge initiative to the UN country team and the government of Lao PDR. Thank you so much, Rachel.
Thank you so much. I think hearing and ending the panel on this very successful partnership and collaboration sets an excellent tone of how we move forward. Thank you so much. And I want to really thank all the panelists. This draws our panel to a close, but really the richness of the suggestions and advice and strategic opportunities here has been enormous. Now, as we move to close, I would like to please invite Mr. Joshua Taba, who is the Director General of Global Health and Nutrition at Global Affairs Canada. Please, the floor is yours.
Thank you, Rachel. President Lebel, Cher Ministre Sagnon, colleagues, partners, friends. Johannes, thank you for mentioning that event in Ottawa in February last year. It was a great event, but I also certainly recall that snowstorm and the havoc it played with so many of our flight plans in the days after. So I'm honored to close such a rich discussion on the fundamental role civil registration and vital statistics systems play in helping to realize the 2030 Sustainable Development Agenda. Over the course of the last decade, Canada has proudly worked with other like-minded partners, governments, UN organizations, civil society, to champion advancements in CRVS. We've done that to change the lives and opportunities of hundreds of thousands of individuals, and particularly vulnerable and marginalized women and girls. Consistent with Canada's feminist international assistance policy, we recognize how CRVS is foundational to reducing the disproportionate impact of structural barriers and discrimination on the lives of women and girls around the world. As the presentations we have heard today have highlighted, CRVS systems are a fundamental cornerstone for human development, for human rights, and for personal and community security. A birth certificate gives access to life-saving vaccines in infancy. It allows us to obtain a passport to travel, a certificate to marry, and eventually the ability to register the births of our own children. I experienced an element of this myself when 2 of my children were born while we were on an overseas posting in a partner country, and had to negotiate the complex web of institutions to obtain appropriate documentation for these births. While we were able to resolve our situation because of our access and support, for hundreds of millions of people worldwide, this door remains closed, further marginalizing those who most depend on critical services and social protection. Vital registration and statistics are both tools to ensure that every person counts and are at the heart of our efforts to achieve gender equality. We must reduce data gaps to have an impact on the lives of the vulnerable, to better identify gender-related barriers, assess gender gaps, develop gender-sensitive evidence-based policies and programs, and then to measure progress toward gender equality. CRVS systems are all the more important now, today, as we try to understand the scale and scope of the impact of COVID-19, which we know has had a disproportionate impact on the most vulnerable populations, and in particular on women and girls. Strengthening CRVS is more than a technical systems issue. It has political drivers and political implications that we must address explicitly. Let me note 3 of these. First, reform efforts must begin with an analysis of equity and gender to ensure that marginalized regions, communities, and peoples are consulted, prioritized, and properly integrated. Second, governments at all levels need to be in the driver's seat when developing and strengthening CRVS systems, but this will work best when meaningfully engaging civil society, when integrating CRVS into national plans, and of course by allocating domestic resources to support these efforts and make them sustainable. Third, we need to ensure CRVS systems work with other data collection systems at both national and subnational levels. The full value of data from civil registries is only realized when integrated with other government systems, statistical institutions, population registers, national ID systems, voter registration systems. Over the past decade, Canada has worked closely with different partners at all levels to strengthen CRVS and improve access to quality data for impact. We've committed $100 million through the Global Financing Facility to strengthen civil registration systems and statistics in GFF partner countries. 22 countries have prioritized civil registration and vital statistics in their investment cases. 14 of these have received funding of nearly $100 million in GFF grants and IDA funding to continue to implement these components. And 5 countries have received additional technical assistance aimed at strengthening CRVS systems. And of course, Canada is proud to have founded the Center of Excellence for CRVS with IDRC and the GFF. The Center of Excellence has played a critical role in achieving national level results by developing knowledge products on CRVS and by collaborating with the GFF to facilitate access to technical assistance and best practices on CRVS systems. Working with the GFF, UNFPA, UNICEF, and others, Center of Excellence has become a globally recognized knowledge hub. I'm thrilled that this important initiative will continue to evolve under the outstanding leadership of UNFPA. I can't wait to see how UNFPA and ULITA will build on the Center of Excellence's achievements and extend its reach and impact worldwide. Our discussion today has painted a striking picture of how CRVS systems can be improved, of the national efforts that are underway, and of the potential gender transformative change that inclusive CRVS reforms can bring. In closing, I'm struck about how we must all commit to continuous effort and improvement. Our work will not be done until every person, every life is appropriately recognized. In Canada this week, we will commemorate our National Day for Truth and Reconciliation as we grapple with the terrible legacy of how so many Indigenous lives were not recognized. We are committed to doing better nationally, and collectively we must do better globally. So together, let's use our energy and our networks to propel momentum on CRVS further, making every life count by counting every life. Thank you again to all the presenters for their compelling remarks.
Thank you so much, Mr. Dubrat. Please, I would like now just to close the event by turning back to Dr. Julita, please, for our final remarks, and then we will close the enclosure of the event. Thank you to you, Julita, please.
Thank you, Rachel, and honestly, such a wonderful and inspiring event today, and I really want to, on behalf of UNFPA, I'm actually extremely humbled because I'm coming into, obviously, you know, such praise for the work that we've collectively done and led. And so I think we end out today with a celebration of, I feel, progress that has been made and that we've heard from country to country, from colleagues and partners in this journey, really, to ensure civil registration and vital statistics is universal and is central to what we have to achieve in the Sustainable Development Goals. A lot has been said, and I really do want to say thank you to Joshua, who I think has summed it up extremely well. And Rachel, to you and your team as well, but you, Rachel, as you took us across each of the panelists and really crystallized some of the recommendations that have come out. I think fundamental, we've heard about a life course and a human rights and a human-centered agenda, one that again looks to not discriminate and to ensure everybody gets counted, particularly from a gender perspective. And I think that's going to be fundamental in underpinning how we move forward. I think we've heard about opportunities in terms of modernization, technology, digitalization, in terms of efficiency in financing and investing for these, in terms of capacities and lessons learned that we can build on. And I really want to borrow Dr. Asma's issue around what we need now is the urgency, the scale, and really the importance of amplifying what we're doing. And with that, I want to just assure you that UNFPA is in it and we're ready to go. Our commitment is obviously full. We want to already announce the momentum, and I know Rachel's got her team or we're revved up in terms of what we need to do in hosting at least a series of additional conversations and related CRVS events, and particularly looking at what we see within the context of very complex and fragile settings where we find at most, and I loved the notion of resilience in our work and systems and building data. And so definitely a series of meetings that we want to conduct in the next few weeks around delivering CRVS in fragile settings. But in addition to that, the richness that we've heard in the conversation today. I do thank the Government of Canada, our colleagues in the Centre of Excellence under IDRC, our many partners who've joined us today in this event. And we look forward to just building on that and taking this forward. Indeed, it is a transformational agenda. It's an integrated agenda, and we can only not fail in this. I thank you very much, and really lovely to meet all of you, and I continue to look forward to our collaboration. Thank you, and back over to you, Rachel.
Thank you so much, and I think between you, Joshua, and Julita, we've heard it all. This has been an extremely rich day, morning, evening, and we would simply want to thank everyone, and we are amazingly exactly on time. So have a wonderful rest of the day and evening, and thank you so much to everyone.
Thank you.
Thank you. Bye, everyone.
Bye.